Welcome to our educational video on bladder agenesis, a rare and complex congenital condition. Bladder agenesis, also known as bladder aplasia, refers to the complete absence of the urinary bladder at birth. This condition presents significant challenges for the affected individual, impacting urinary function and overall health. In this video, we will explore the causes, symptoms, diagnosis, treatment, and management of this rare anomaly. The exact cause of bladder agenesis remains largely unknown, but it is considered a sporadic developmental defect occurring during early embryogenesis. It's believed to arise from disruptions in the formation of the cloaca, a common chamber in the early embryo that eventually divides to form the urinary, intestinal, and reproductive tracts. Genetic factors, teratogens, agents that can cause birth defects, and other environmental influences during critical periods of development may play a role, but definitive links have not been established. Research continues to explore potential causative factors involved in bladder agenesis. The absence of the bladder has profound implications for urinary function. Normally, the bladder serves as a reservoir to collect urine produced by the kidneys, allowing for controlled and voluntary urination. In bladder agenesis, urine produced by the kidneys must find an alternate route for excretion. This often leads to urine being continuously diverted, typically through surgically created pathways. The kidneys, ureters, and other urinary structures can experience increased pressure and potential damage due to the abnormal flow and storage of urine, often leading to complications like hydronephrosis, where the kidneys swell with urine. Bladder agenesis is an exceedingly rare condition. Its exact incidence is difficult to determine due to its rarity and potential for being underreported or misdiagnosed. Estimates suggest it occurs in less than 1 in 1 million live births. Because of its rarity, large-scale epidemiological studies are challenging, and much of the information comes from case reports and small case series. It appears to affect males and females equally. The most obvious sign of bladder agenesis is the absence of spontaneous urination after birth. Instead, urine typically drains through an abnormal opening, such as the umbilicus perineum or a surgically created stoma. Other associated symptoms can include abdominal distension, particularly if urine is accumulating in the upper urinary tract. Because bladder agenesis often occurs alongside other congenital anomalies, affected individuals may also present with defects involving the kidneys, ureters, genitalia, or other organ systems. These associated anomalies can complicate the clinical picture and necessitate a comprehensive evaluation. Diagnosis of bladder agenesis typically occurs shortly after birth. A physical examination may raise suspicion if urination is absent or abnormal. Imaging studies are crucial for confirming the diagnosis and identifying any associated anomalies. Ultrasound is often the initial imaging modality used to assess the kidneys and urinary tract. Voiding cystoscopy CUGs, a special type of X-ray, can help visualize the urinary tract anatomy. Magnetic resonance imaging (MRI) may be utilized to provide detailed images of the pelvic region and assess the presence or absence of bladder tissue. These investigations help confirm the diagnosis and guide surgical planning. While there are no specific classifications or types of bladder agenesis in the traditional sense, the severity and associated anomalies can vary considerably from case to case. Some individuals might have complete absence of the bladder without other major malformations, while others may have more complex presentations with multiple congenital anomalies involving the urinary, genital, and gastrointestinal systems. The approach to management will depend on the specific constellation of anomalies present in each individual. Treatment for bladder agenesis is complex and requires a multidisciplinary approach involving pediatric surgeons, urologists, nephrologists, and other specialists. The primary goals of treatment are to achieve urinary continence, protect kidney function, and improve the patient's quality of life. Surgical reconstruction is often necessary to create an alternative pathway for urine drainage. This might involve creating a urinary diversion, such as a cutaneous ureterostomy, where the ureters are brought directly to the skin, or a continent urinary reservoir. Lifelong monitoring of kidney function, management of urinary tract infections, and psychological support are essential components of long-term care. Because the exact cause of bladder agenesis is unknown, there are no specific measures to prevent it. General prenatal care, including avoiding exposure to known teratogens, such as certain medications, drugs, and alcohol, is crucial for promoting healthy fetal development. Genetic counseling may be considered if there is a family history of congenital anomalies, but bladder agenesis is typically a sporadic occurrence. Further research into the underlying causes is needed to develop strategies for prevention. The prognosis for individuals with bladder agenesis depends heavily on the presence and severity of associated anomalies, as well as the success of surgical reconstruction and long-term management. While challenges exist, advances in surgical techniques and medical care have improved outcomes. Research is ongoing to explore novel approaches to bladder reconstruction and urinary continence. Tissue engineering and regenerative medicine hold promise for future bladder replacement strategies, but are still in the experimental stages. With diligent medical management and support, individuals with bladder agenesis can lead fulfilling lives. Thank you for watching this video.